Good morning and welcome. I'm Senator Bill Frist, and this is part 5 of our continuing COVID discussion on the fiscal, monetary, and health policy responses and implications for the economic outlook. Our discussion is sponsored by Princeton University's Griswold Center for Economic Policy Studies, the Center for Health and Well-Being, and the podcast, A Second Opinion, Rethinking American Health. I'm delighted to be here today with Princeton University's Jessica Metcalf, Alan Blinder, and Bill Dudley. A little about our presenters. Jessica Metcalf, Associate Professor of Ecology, Evolutionary Biology, and Public Affairs at Princeton. Professor Metcalf is a disease modeling expert. She will kick off today's discussion offering the latest understanding of the epidemiological trajectory for the disease and its health policy implications. Alan Blinder, the Gordon Rechler Memorial Professor of Economics and Public Affairs and former Vice Chairman of the Board of Governors of the Federal Reserve and op-ed columnist for the Wall Street Journal. He will share his insights on the fiscal outlook. And Bill Dudley, Senior Research Scholar of the Griswold Center for Economic Policy Studies and former President of the Federal Reserve Bank of New York. Bill will share his perspectives on the monetary policy implications of the pandemic. Each of our discussants will open with their outlook, and then we will turn to a general discussion followed by your questions. A few quick housekeeping notes. If you'd like to submit a question, simply click on the Zoom Q&A feature located at the bottom of your Zoom window, and you can also upvote any questions you'd like to see answered. If you'd like to re-listen to today's talk or share it with friends, which we encourage, a full recording will be posted on the Griswold Center's website and next week on a Second Opinion podcast, which you can find on Apple or Spotify or YouTube. Before we dive in, I do want to reflect just a brief moment of where we have been. The four of us first got together on April 16th, 2020. For our very first virtual event on COVID and the economy. None of us predicted at that moment the full challenges our nation would face in the months and now years that have followed. Over that time, we've created safe, effective vaccines that are protecting a majority of Americans today. We've seen the federal government borrow and lend and spend trillions of dollars to keep the economy afloat. We've seen an unexpected stock market boom, a concerning spike in inflation, several worker shortages, which are now severe, and the great resignation, a growing wealth gap and financial inequities, and viral variants that continue to threaten our efforts to return to pre-pandemic life. With this backdrop, today's presenters will shed light on what the very latest economic indicators mean, what we can learn from the events of the past 2 years, and how the pandemic will influence policy going forward. And now let me turn to Professor Jessica Metcalf. Jessica.
Thank you very much. Oops, can you see my screen?
Yes, indeed.
Wonderful. Well, good morning. So as Senator Frist said, we are once again here to discuss the state of the pandemic. As I'm sure everyone is aware, the most recent development is that in late 2021, scientists in Botswana, Sikolili Moyo, and South Africa, Tulia de Oliveira, and their teams identified a new variant that had an unusual number of mutations, and they alerted the World Health Organization. Analysis of the sequence of this variant suggested that it looked so little like the ones that had been circulating up to this point that it was likely to evade our immunity, and neutralizing antibodies would struggle to identify it. This, in fact, proved to be the case. The new variant Omicron evades antibodies and can infect individuals with prior immunity, whether they be vaccinated or infected. There's still some protection against infection, but the rates of infection are high. Boosters do seem to reduce this potential, presumably by broadening the immune response to be able to capture this new, very different variant. This new variant is also more transmissible, even than Delta, the Delta variant that had come before, and it spreads incredibly quickly. It's thought that the period separating exposure to symptoms might be shorter, so as short as 3 days, and this will certainly complicate any efforts such as contact tracing. On the plus side, it appears to have reduced ability to infect cells of the lower respiratory tract, at least in animal models, and this might partly explain the reduction in severity. But it is also important to note that we're looking at a reduction in severity in the context of populations that have very high levels of prior immunity, whether they be via vaccination or infection. And we do expect precisely immunity to reduce severity by the action of T cells, so an arm of the immune system designed to protect against disease rather than infection per se. And it's important also to note, of course, that people are still winding up in hospital and people are still dying. A fact that people bring up again and again is that even if the infection were half as severe, if it's twice as transmissible, it will yield the same pressure on the health system, and staffing issues are proving to be ubiquitous. I mean, it's always considered per capita severity in the context of numbers infected. And so far, this surge has suggested that vaccines are unlikely to be enough alone, at least in this particular context. We need to be able to control transmission, to manipulate at least transmission, perhaps via fairly targeted efforts, such as rapid tests that allow individuals to identify whether they're infected or not. And this is relevant for this particular surge, for future variants, and possibly for future pandemic threats. There are many remaining questions, even though, as has been the case throughout this pandemic, the rate of growth in scientific knowledge has been really remarkable. We still don't know exactly the details of severity of Omicron in the unvaccinated, across different doses of vaccination, over age, in particular groups. And the key question remains net severity, so the chance of hospitalization times that number infected. We also, and this is a really big question mark, don't know much about the relationship between Omicron and long COVID, but this of course has long-term and very hard to understand consequences that we will need to grapple with as we think through health policy. And something that people have been increasingly raising is that the impacts of this sustained pandemic, these 3 years that we've been through, well, two starting into 3, is what it's doing to the health system, what it's doing in terms of health worker fatigue, and what it's doing in terms of endurance for continuing forwards. And all these different pieces, learning more about all these different pieces are going to be important for thinking about how we plan interventions, how we think about vaccination, how we think about boosters or updates, and think about health policy going forwards. I think we can broadly sketch out 2 possible futures. We'll start with the optimistic future. This could be the start of the end. We could be on the start of a bumpy path to endemicity. There are still questions around the unvaccinated. There are still questions about the fact that children, of course, are not yet vaccinatable, the very young children. But there is, throughout the population, a rising tide of T-cell immunity. And even if individuals continue to be infected, we could be moving into a world where this does not associate with severe disease. So even if the virus drifts to evade immunity from infection, we might still be in a good place. There will be cases, but not overwhelming numbers in hospitals. That's the optimistic future. The pessimistic future is that a new variant could emerge that once again evades immunity against infection, but is also more severe, so evades those T cells that are protecting against severe disease. And this could move rapidly through populations, resulting in large numbers of severe cases and once again overwhelming health systems. I'm relatively optimistic, I think, more on the optimistic side, but of course there have been surprises throughout this trajectory. And I think it's important to note that the virus is doing all the experiments. The more cases there are, the more times the virus gets to juggle its genome and explore ways in which it can shape its transmission through our populations. And the way we can attempt to impede this is by reducing transmission, which involves international vaccination, including potentially of immunosuppressed individuals who have been suggested as a potential source of important new variants. Of course, it's very likely, as is often the case, we end up somewhere between these 2 extremes, not the most optimistic nor the most pessimistic. There is ongoing circulation, there is some maintained severity of cases that we need ongoing public health interventions to control. But controlling levels of infection proves tractable and doesn't perturb our entire economies and health systems. And we just move into a world where, perhaps boosters, perhaps rapid tests, some other aspects give us a path forwards through this pandemic into a more endemic world. And that's what I have for you.
Jessica, thank you. Thank you so much. Alan, Professor Blinder.
Sure, let me try to share my screen. All right, I think that worked. Yes?
Yes, indeed.
Okay, good morning, everybody. I can skip over this. The last of these updates was April of 2021. We're getting close to a year. And I just put up this chart. You've seen these. This is the New York Times coronavirus map for the United States, which they publish every day. I just added to show you where April was. This is where we were when we talked last time. This is where we are today. Now, as Jess just said, and as of course you know, this was basically pre-Delta and Delta. This is basically Omicron, so they're not completely comparable. But the point that this graph makes very starkly is that the number of cases is just gigantically higher, not quite an order of magnitude. Well, actually, from April, it's actually about an order of magnitude higher than it was then. So while the death rate is well down from what it was then, the number of deaths is higher than it was in April, but blissfully lower than it was in the more recent peak. That's kind of the backdrop, and I give you the backdrop as a kind of an indicator of how frightened people might be or might not be, and therefore what this might be doing to their willingness to contact other people, whether it's in the workplace or in stores and restaurants and things like that. So the last spike we had, let me go back 2 slides. The last spike we had was here. We thought that was pretty bad. It's nothing compared to what we're having now. And the economy powered right through it. So what I've shown you here in the 2 panels are jobs from the payroll survey and real GDP. And these arrows indicate where that last spike was. And if you were just looking at these graphs, you couldn't identify the spike. If you look at the health graph, you can certainly see the spike. But the economic graphs don't show it at all. So as it says on the title of this slide, the economy, and it wasn't only the US economy, though these are US numbers, the economy powered right through that last spike, leaving us on jobs about 3.5 million below where we were just before the pandemic. That's here, but leaving GDP well above. We reached the previous peak in GDP back around here early this year, and the growth rates for this year have been strong. So this, by the way, was well better than what most people thought would happen back in the dark days. So why and how? Well, the first reason, of course, is vaccines. I think this whole picture would look very, very different if we didn't have 60-odd% of Americans vaccinated. It's a shame we don't have more than that, but that's a different story. The majority is vaccinated, and that makes a huge, and boosted, and that makes a huge difference. In addition to that, and this is a hunch, I think maybe as important quantitatively is that COVID fatigue has made a lot of people, has given a lot of people the attitude, enough is enough. I've been cowering in my house long enough. I'm going to go to restaurants. I'm going to go to movies. I'm going back to work, and so on. It was a fallacy that keeps getting repeated that the government shutdowns in March of 2020 is what put the economy into, the phrase was used, like a medically induced coma. The truth is, if you look at the data, people were shutting down before the government told them to shut down. And they were shutting down for a very simple reason. They were afraid of contracting a deadly disease. It's much less deadly now. People are less afraid now. And, you know, you can get used to anything. This is relevant, I think, highly relevant to the current situation. Thirdly and fourthly, put these together, the US private sector, the business sector, has shown tremendous resilience and adaptation in a whole variety of ways, changing their business models in ways that allow contact-free service. These things range from telemedicine by doctors to restaurants that never had any takeout business, suddenly doing more takeout business than they ever had before, and everything in between. And that, of course, was assisted by an enormous fiscal expansion, pushing up demand. And as I'm coming to that on the next slide, just to finish this slide, there was also an enormous monetary expansion, which I'm not going to say anything about, leaving that to Bill Dudley to follow. The fiscal expansion. So as you all will remember, the gigantic CARES Act passed really fast. Look at the date, March 20, by Congress, is still the biggest bill that Congress has ever passed. It was about $2.25 trillion then. It's been criticized for a number of good reasons, one or two of which I'll mention briefly. But it had two tremendous assets, which it was huge and it came fast. And we needed big and fast right then. So thank heaven the Congress did that. The next big stimulus was called the Consolidated Appropriations Act, December of 2020, almost $1 trillion in COVID relief. And the third came, so this is the end of the Trump administration. The third came close on the heels at the beginning of the Biden administration, the American Rescue Plan, which is almost another $2 trillion. Do the arithmetic and add in the infrastructure bill, which I haven't included here because it's not explicit, well, for two reasons. It's not explicitly a COVID relief bill. And secondly, the spend out on infrastructure is going to be really, really slow. The spend out on these other things was meant to be fast. If you add it all up, that's about $6 trillion of fiscal stimulus. And that may be all. Now, I don't want to belittle. $6 trillion is a titanic number. It's in the ballpark of 25% of GDP. Now, it didn't all come in one year, but it came fast, as you see from the dating here. So that's a lot of money, and it's probably all there will be. As you all know, the Build Back Better plan is on life support in the US Senate, and it doesn't look like my guess is the life support's not going to work, but we'll see. But just as important, if anything passes under the name Build Back Better or any other name, it's likely to be paid for, which means there's going to be, say, a tax increase or cutbacks in some other spending to pay for it. So it won't be 100% net fiscal stimulus the way the others were. So that said, $6 trillion is a hell of a lot of money. A couple of quick observations on the fiscal response. It was fast and huge, as I said. Some of the pieces of the CARES Act and others have been criticized for being sloppy and poorly targeted. That certainly includes the PPP, Payroll Protection Plan, forgivable loans, and the so-called checks, which are sometimes called rebates, but they were just checks sent out in, well, 3 waves, 1,200, 600, 1,400, poorly targeted. Many people that didn't need it got it anyway. Many people that needed it badly because they weren't on the IRS rolls didn't get it. This whole process of fiscal response to the pandemic started out strongly bipartisan. The CARES Act was incredibly bipartisan. It was like basically unanimous. And now what's left, the end game, so to speak, is totally partisan. As you know, President Biden is trying to get around the filibuster because he'll be lucky to get 50 votes by Democrats in the Senate. He probably won't. This is a stark difference from where this process started. And the last thing that's worth mentioning is that all this actual and projected debt, public debt, has not driven up long-term interest rates at all, basically. So here's a picture. I highlight here where the 10-year bond rate was before the pandemic. So it was kind of in what market people like to call a trading range between 1.5 and 1.9 for a while. During the pandemic, it dropped nearly to zero, about 50 basis points. Stayed around the cellar for a while and then started returning to normal. So by the time we got here, which is like March of last year, we were almost, but not quite back to the pre-pandemic bond rate. And that's about where we are now. There's been a lot of fuss about this, about rising bond rates because of inflation or because of debt or because of whatever. But as you look with a bit more perspective, and not a long time perspective, I'm only going back here to the beginning of 2019. It's hard to call this bond rate high. It's very hard to call this bond rate high. So one reason for, one reason for that is about half of the new Treasury debt issues have been bought by the Federal Reserve. Now, I don't mean that literally. The Federal Reserve doesn't buy it in the primary market. They go in the secondary market and make room, so to speak, for the new issues. But it's, you know, in terms of supply and demand, pressure on supply and pressure on demand, it's as if they were buying half the Treasury as issues as they were coming out. And that matters, of course. If you're asking the question, how can you sell all this stuff without the price going down? The answer is you got to have a new buyer coming in, and the Fed was that new buyer in a big way. But as it says at the end of the slide, this is ending very soon. The Fed is tapering its purchases quickly now and is already talking about starting to sell. I'll leave any of that to Bill Dudley, who's coming next. Last, and certainly not least, today's big issue is inflation. As a lot of people on this webinar know, there are many ways to measure inflation. I'm not talking about hypotheticals, but actual government statistics of inflation. What I show here is the one that's most important to the Federal Reserve, which is the core, that is leaving out food and energy, PCE inflation rate, personal consumer expenditures in the national accounts. And the last number there is 4.7. Now, the CPI non-core gets much more attention. Its last number was 7. You get from 7 to 4.7 by first moving to core, because energy's been a big driver of that 7% CPI rate. And secondly, the CPI almost always runs higher than the PCE as a measure of inflation. They differ in dozens and dozens of ways, so there's no one reason for that. There are many, many reasons, but PCE is always, just about always lower. The Fed's target is for the PCE to be 2% per annum. And as you see, it was underachieving that for a long time. And this is what's happened lately. One point I want to make from this, the graph, because it has to do with embedding inflation in inflationary expectations, is this is a new phenomenon. We have not had high inflation for years. We've had high inflation for months. And how quickly this dissipates is crucial, I think, to whether and how it gets into inflationary expectations. Which brings me to the last slide, explaining why I'm still on what's become called team transitory. That's the subset of us economists, and I think we're in the majority, by the way, that keep saying this is not going to stay with us, this is going to go away. Importantly, though, for us members of Team Transitory, we don't mean by that it's going to go away in another month or two. This is going to be with us for a while, but it might go away in a year's time, say, something like that. So, last slide. Why am I still a member of Team Transitory despite this, despite inflation going up, 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 up? First and most important is if you look at the details, inflation is still fairly concentrated in a subset of the goods and services that comprise the index. In other words, it says here, it is broadening out a bit. One simple indicator of that I always watch is the difference between the official rate and the Dallas Fed's trimmed mean, which takes out the highest and the lowest inflating pieces. That's just showing 2.8% inflation. Second, as I mentioned obliquely before, energy prices were one of the drivers, and they're starting to come down. Only a bit so far, but moving down, not up. Third, as I did mention, well, I mentioned in terms of fiscal and barely in terms of monetary, the stimulus put in by the US Congress and by the Federal Reserve is disappearing. And the important word in this sentence is fast. Those COVID relief programs were meant to be spent out quickly, and they have been. They are being spent out quickly, and the Federal Reserve is changing on a dime. Fourth, the bottlenecks and the shortages are already starting to dissipate. Just barely, however. It's very disappointing how slowly this is happening, especially for someone like me who believes in capitalism. We believers in capitalism believe that profit-oriented capitalists will jump in where there are opportunities for profits, and shortages are opportunities for profit. So this is happening a bit, but it's happening fairly slowly. And the speed at which that happens is crucial to the dissipation of inflation. And finally, a lot of this is driven by a mismatch in what's going on in goods versus services. I get into the habit of calling this a supply shock, as many people did. But in some sense, it's really an aspect of the demand shock. Because people are still afraid to buy too many services, go to restaurants, movie theaters, and hotels, and so on, they're buying goods like mad. And it's not so much, it's not that container ships disappeared or crashed or burned or anything like that, reducing the capacity. It's that because the consumer basket shifted so much in terms of goods, it's overstretched the ability of ships, trucks, and all of that stuff to deliver it. That will straighten itself out as the virus subsides, but as it says here in parentheses, Omicron is a setback to that. Thank you.
Good, thank you, Alan. Now we'll go to Bill Dudley for his perspectives on the monetary policy implications, as well as other issues around COVID-19. Bill?
Thank you. Let me share my screen. Okay, so I'm going to talk about monetary policy, and the Fed has had a very, I'd say, uneven experience during the COVID pandemic. I think the early stages of the Fed's interventions were highly successful, broadly supported, very popular. The Fed responded early during the pandemic very quickly. very powerfully and very broadly. They cut rates to zero, which supported housing and motor vehicle sales. They introduced liquidity backstops that restored market function. The enormous balance sheet expansion made the treasury market function better and made financial conditions extraordinarily accommodative. The only downside from the Fed's early interventions were that the benefits did accrue unevenly, with higher income households who hold financial assets disproportionately aided. And obviously, the burden of the pandemic fell unequally on people depending on in terms of what their employment was. At early stages, the Fed's interventions were excellent. But I think as we look out over the last 6 months or so, we have to conclude that since then, the Fed hasn't done quite so well. In my mind, the Fed Reserve kept policy too easy for too long. And I think this is due to 4 major errors. The first error was in terms of how the Fed operationalized their average inflation targeting regime. This is the regime where they basically said the Fed is now going to try to achieve 2% inflation on average. And they basically said that we're going to do this by committing not to raise interest rates until inflation's at 2%. Inflation's expected to be above 2% for some time in the future. And we've achieved maximum sustainable employment consistent with that 2% inflation objective. The problem with operationalizing monetary policy in that way means that policy will be extraordinarily easy even after the economy has reached full employment. And that's the situation where we find ourselves in today. The Fed is still adding monetary policy stimulus, even though headline inflation, looking at the CPI, that's the worst number you can pick, 7%, and the unemployment rate's at 3.9%, which is below the Fed's estimate of full employment. They didn't have to operationalize the average inflation target regime in that way. They could have committed to lift off a bit earlier, but this locked them in and made them slow to respond. The second mistake I think the Fed made is they worried very much about generating a bond market taper tantrum. That's what happened in 2013 when Ben Bernanke mused about the fact that the asset purchases were going to have to end at some point. This Federal Reserve was very nervous about causing that event to happen again, because that would inadvertently tighten financial conditions before the Fed actually wanted to do so. So the Fed basically was very careful to not talk about tapering until the economy got to a very high level of economic resource utilization. The taper was also rolled out until substantial progress was made to the 3 goals stated above. So the Fed Reserve, that's why we find ourselves in a situation today where the Federal Reserve is still buying assets, even though the economy is operating at a very high level of resource utilization. Third mistake, I think, is the inflation shock has turned out to be not entirely transitory. I agree with Alan that a good portion of the higher inflation we see is due to supply chain disruptions, the shift in the demand from services into goods. And a lot of this is going to go away as the pandemic starts to become endemic. But I think what we're seeing now is that the inflation has been higher for longer, so that it's actually starting to get into wages. And it's also starting to get into inflation expectations. What that means is that even though the shock might be transitory to start, it could actually have more persistent effects. And I think that the Federal Reserve did not anticipate this risk. And the fourth problem, which is not a bad problem, but it's still a problem, is the labor market has tightened much faster than the Federal Reserve expected. If you look at what the Fed commentary has been over the last 18 months or so, the Federal Reserve is focused on the gap of employment relative to where it was in February 2020. And that gap today is still 3 million workers. We're still 3 million lower number of people employed today than we were in February 2020. Despite that, the unemployment rate is already below the level consistent with the FOMC's estimates of full employment. What's happened is the labor force participation rate, which dropped quite sharply at the onset of the pandemic, has come back only very, very slowly. And this has been a disappointment to the Federal Reserve, who thought that there was more slack in the labor market that they anticipated. Presumably, the reason why the participation rate's not coming back very quickly is number one, a lot of people have retired because of the pandemic. Number two, there are health risks, and there are some people who just don't want to take jobs where they're exposed to COVID. And third, I think long COVID's a factor as well, where people are still ill, and that's inhibiting their ability to return to the workforce. If you look at some important measures of the labor market, it really already looks extraordinarily tight. If you look at the number of unfilled jobs, it's basically at or close to a record level. And if you look at the ratio of unfilled jobs to the number of people that are unemployed, this is an all-time record. So there's lots of open jobs out there relative to the number of people that are seeking employment. The other thing that I think tells you that the labor market is very tight is that we're already seeing wage acceleration. And the wage trend that we're seeing is already above that. That's consistent with 2% inflation. So if you look at the average hourly earnings, the last 12 months, it's risen 4.7%. The only way that's consistent with 2% inflation is if productivity growth surges or if profit margins come down significantly. So where do we go from here? Well, what are the implications for monetary policy? Well, the Fed is late, and I think they know they're late, and now they're trying to catch up. We know they're late because they're still buying assets. They're still adding monetary policy stimulus today, even as the unemployment rate has fallen below 4% and inflation's above 5% by most measures. So this is why the Fed has accelerated their asset purchase program to complete the asset purchase by mid-March. Originally, when they announced it, they were going to conclude it in mid-June, so they've moved it up by 3 months. The reason why they did this is that they don't think it's appropriate to be buying assets and raising short-term interest rates at the same time, because you're adding monetary policy stimulus with one hand, you're taking away with another. So they made it very clear early on that the taper would have to be finished before they actually lift it off. So they've accelerated the taper so that they can lift off following the March FOMC meeting. Omicron, I don't think, is a major factor in their thinking, because I think that they see that Omicron has offsetting effects. It reduces demand, but it also reduces supply. So the net effect on the economy and on inflation is ambiguous. I think that they also view Omicron not as a major factor because it's less virulent. And the degree of social distancing, as Alan references, is less for any degree of risk. People are getting used to the COVID pandemic, and so they're willing to take a little bit more risk than they were earlier. And finally, it looks like Omicron, the spike up is going to be fast, and the spike down hopefully is going to be just as fast. And so this is a factor that's probably going to be with us for months as opposed to quarters or years. And so I think the Fed's view is by the time we get to March or April, the Omicron caseload is going to be diminishing quite sharply. So what's expected? So if you talk to the Fed officials and you look at what they projected in terms of their economic forecast, as of December, they penciled in 3 rate hikes for 2022, 3 rate hikes for 2023, and taking the median federal funds rate forecast up to 2.1% at the end of 2024. This is already probably a little out of date, given how strong the economic data has been on the inflation and labor market side. Market participants are basically in the same place. They probably expect the Fed to do a little bit more this year and next, but the anticipated peak that market participants have factored into the market is a peak in the federal funds rate of only around 1.75% to 2%. In my mind, these are very extraordinary forecasts. The Fed's forecast in particular is quite striking. They have the economy operating beyond full employment. They think full employment is around 4%. They have the economy operating beyond full employment for 3 whole years, yet they have inflation melting away back towards their 2% objective. So if you look at their inflation projections next 3 years, 2.6% for 22, 2.3% for 23, 2.1% for 24. That's a pretty remarkable forecast because it has inflation melting away without the Fed ever having to move to a tight monetary policy setting. So what's my view? Where do I fall out? Well, I think first of all, we're going to see more rate hikes this year than what's penciled in currently, And the Fed's almost certainly going to start hiking rates at the March meeting. I think we're going to see at least 4 rate hikes this year, and maybe more, depending on how quickly inflation starts to fall back towards the Fed's 2% objective. The second thing is, I think the peak is going to be considerably higher than what market participants and the Fed anticipates. Bottom line is, I think that the Fed's going to have to move to a tight monetary policy rather than a neutral monetary policy. Now, first of all, we have to point out that neutral is going to be higher because inflation is higher. If inflation is running 2.5%, 3%, to get to neutral, the Federal Reserve is going to have to get to 3 to 3.5% in terms of short-term interest rates. And if the Federal Reserve has to make monetary policy tight, they're going to have to go even beyond that. So a peak of 3 to 4% seems pretty. It sounds high when we talk about it today, but I think it's actually, completely a reasonable expectation. If you look at the last 2 cycles, they're very different in terms of what the Federal Reserve had to do in terms of monetary policy tightening. Between 2004 and 2006, the Federal Reserve raised the federal funds rate a 1/4 point, 17 consecutive FOMC meetings, taking the federal funds rate to 5.25% from 1%. So that's the less benign outcome. In 2015 to 2019, it was much more drawn out. The federal funds rate peak turned out to be only 2.25% to 2.5%. So the question is, which of these is the right template for how this is going to unfold? In my mind, there's really 2 important things to keep your eye on. The first is what's happening to inflation. And the second is how sensitive are financial conditions to what the Fed does. If the Fed tightens a little and stocks go down a lot, then the Federal Reserve doesn't have to do as much to slow the economy down. In 2004, 2006, inflation was above target, and stocks and bonds were very insensitive to what the Fed was doing. And so the Federal Reserve had to keep going. They had to take the federal funds rate all the way up to 5.25%. In contrast, in 2015 to 2019, inflation was at or below the Fed's target, and stocks and bonds were quite sensitive to what the Federal Reserve was doing. So if it turns out more like the 2015-19 scenario, then the market forecast and the Fed forecast will probably turn out to be right. But if it turns out more like the 2004-2006 environment, my forecast of 3 to 4% is going to turn out to be too low rather than too high. And I'll leave it there.
Thank you, Bill. Why don't we go ahead and turn to our general discussion and our Q&A portion of our event today. And to our audience, if you haven't already, please go ahead and submit questions again by clicking on the Zoom Q&A feature. And we have a number of questions that have already come in, but I encourage you to send your questions in, and we'll get to as many as we possibly can. Alan and Bill, let me just turn to you since we're coming off the sort of opening comments. And Alan, I'll begin with you. Is there anything that you heard Bill say that either surprised you or you don't agree with, and why? And then Bill, let me turn to you because both presentations, excellent, superb, but I'm sure there are things ticking in your mind saying, well, I don't quite agree with that. But Alan, let me turn to you first. You're on mute, Alan. I'm sorry.
Got it. I'd be a little less critical of the Fed than Bill was. And I think if you ask what surprised me, the number 4% on the Fed funds. I think when we get off the program, Bill and I make a little side bet on that. That would be a surprise. It's not impossible. And he laid out a scenario in which it would happen, and it's not a crazy scenario. The question is putting probabilities on things, and I don't think that's very likely. It would require inflation to linger in the quote too high range longer than I think is likely. Now that's another, there's a wide range of views on that, but we people on Team Transitory think that we're going to see a 3%-ish inflation rate before too long, not next month, but before too long. And I think, frankly, the Fed will be fairly relaxed about inflation in that range, even though 3 is bigger than 2. So that doesn't mean they'll start waving the flag of victory. They'll still grumble about inflation being too high, but I don't think they'll be jacking up the Fed funds rate with alacrity because the inflation rate is 3 rather than 2.
Yeah, and Bill, what about with Alan's opening comments and response to that, if you'd like?
Well, I certainly agree with Alan that a good chunk of the inflation pressures we're seeing now are due to factors unleashed by the pandemic. And inflation will come down in 2022 and will come down significantly. But what we have to, I think, focus on is what's left with inflation, just due to the fact that we've had high inflation for a while now. And how does that get embedded into the wages, and how tight is the labor market? Where I would put my emphasis is not really so much on what the inflation print is going to be 6 months from now. I wouldn't be surprised at all if we saw 3% inflation 6 to 12 months from now. What I would be more concerned about is the tightness of the labor market, the consequences of that on wages. And once those transitory factors wash out, which is going to pull inflation down for a while. You know, as we unwind used car prices from going up 25% to going down 10 or 15% a year, that's going to be holding inflation down. Once all those transitory factors wash out, then I think inflation is going to start to go back up again because we have a very tight labor market and we have higher wages. In terms of, people think that 3 to 4%, view of where the federal funds rate's going sounds high. But, I was looking at what markets have priced in and what the Fed's priced in. That would be the lowest peak in the federal funds rate at any time going back to the 1950s. So even in the 1950s, when inflation was very low, the federal funds rate peaked above what's priced in today. So look, I think, I'm trying to be a little bit provocative by saying 3 to 4%, and Alan's emphasizing the 4%, and maybe I want to emphasize the 3%. But my point is, it's not unreasonable to think that if inflation's running 2.5 to 3%, and the Federal Reserve has to make monetary policy slightly tight, that couldn't require a federal funds rate north of 3%. It really depends on how the financial markets react to that, and that's really the big wild card. If you talk to people in financial markets, they think that a little bit of Fed tightening is going to cause stock prices to go down dramatically, bond yields to go up significantly. And as that happens, that will slow down the economy significantly. And that's really the wild card. Last time the market was pretty sensitive to the Fed, but in other cycles, it's been quite insensitive to the Fed. And so I think how financial conditions respond to what the Fed does will ultimately drive how far the Federal Reserve has to go during this business cycle.
Yeah, thank you. Just make it a little more specific. AJ Schroff of Ridgely Capital, Alan, to you said, what probability do you assign to 5% or higher core PCE in 2022 and 2023? And if the probability is less than 50%, what gives you confidence inflationary pressures will ease?
It is less than 50%. It's certainly not 100%. I think 5% for 2022 is a pretty high-end estimate. Not impossible, but a pretty high-end estimate. I'm not sure what the probability is. 20% maybe. I just pulled that out of the hat, not out of a computer model. Sorry, what was the second part of the question? What would make that happen?
Yeah, and if the probability is less than 50%, what gives you confidence inflationary pressures will ease?
Yeah, so I sort of had a list of them in my last slide. I think the post-pandemic craziness, let's just call it, because as I said, I'm not sure we should be calling it a supply shock, because a hunk of it has to do with the shifting of demand to goods and away from services. And I think that will reverse as long as the pandemic doesn't send people scurrying back into their caves again. Energy prices are coming down, not up. And as Bill was just saying, using used cars as an example, some of these high inflating components of the CPI that have been driving these wild numbers are going to disappear. When I think we're pretty sure used car prices won't keep going up 25% a year indefinitely. If it is, I'm selling all my cars. So, I mean, those are some of the kinds of things that are almost certainly going to drive inflation down. Now, I think probably the 5% is a reference to relative to the 7% CPI. But I just want to remind you that the core PCE, I showed that graph, was only 4.7. So it hasn't hit 5% yet.
Yeah.
So I think if you use that as the measure, the chances that we're going to have a 5% year on that measure are quite small, very small.
Good.
Senator, if
Good.
I could ask a question of Alan, if that's okay.
Yeah.
So Alan, so I think we agree on that, that a lot of the inflation pressures we're seeing now are transitory, and I've emphasized the labor market. What's your assessment of how tight the labor market is, and how worried are you about the fact that the wage trend may be inconsistent with 2% inflation?
I agree with you very much that it's extremely tight. But I'll flip the script on that a little bit. I can find in the tightness of the labor market more than enough reason for the uptick in wage settlements. So there's always this question, how much of this is inflationary expectations getting in wages, and how much of it is kind of the real balance of supply and demand? I agree with you where the real balance of supply and demand is, and it's where it should be pushing up wage settlements. And I'm not at all convinced, we don't have the kind of data we have in financial markets, but I'm not at all convinced that the operational inflationary expectations inside labor markets is terribly different from the ones that we can read, the ones that are in financial markets. Could be, but I don't, directly to your question, I think I can explain the current wage behavior by the tightness of the labor market.
Got a bunch of fantastic questions coming in, and I'll try to go through these quickly and bounce around. Let's take a few more straight economic questions, and then Jessica, a number of more clinical surveillance type questions. Michael Bordeaux, this for Bill. What about the Volcker scenario? The policy rate is more than 5% below the Taylor rule rate, and real rates are very negative. The 2004-2006 scenario will still lead a large inflationary gap, suggesting the Fed may have to really slam on the brakes, leading to a recession. Michael Bordeaux, that's for you, Bill.
Well, that's a scenario where inflation, I think, is higher than what even what Alan and I think is likely. That's sort of a 4% kind of inflation environment. I think you have to think of the Fed as sort of having two sort of situations. One, if inflation is running 2.5 to 3, the Fed's concerned, but they're not so concerned that they're going to slam on the brakes to and generate a recession. If inflation's 4% or higher, then I think the Fed would be much more aggressive in terms of monetary policy. Contrasting to Paul Volcker, inflation was more like 10% when Paul Volcker came in. So that's a totally different scenario. I think it's, when people talk about the 1970s experience, I think it's really important to emphasize that took a long, long time for inflation to get to 10%. And to that point that Alan was making just a moment ago, while inflation expectations may have drifted up a little bit over the last 6 to 12 months, they're still pretty well anchored around 2%. If they're above 2%, they're not way above 2%. So we're a long way from a Volcker kind of scenario where inflation's running way, way north of the Federal Reserve's objective, and the Federal Reserve has to deliberately take a recession to push inflation back down and get inflation expectations anchored. I don't think we're anywhere close to that. At the end of the day, though, the Federal Reserve has to do its job. The Fed has said that they're going to do their job, but in my mind, that they then have to follow up with that by making policy as tight as needed to keep inflation in check. And so that's really the question of how things are going to play out over the next couple of years. Will the Fed do what they need to do to keep inflation from rising above, say, 2.5 to 3%?
Good. The Julie Bryan asked, thoughts on implications for continued fundamental supply shortages and inflation if COVID fatigue continues and worker illnesses continue on potential further COVID mutations?
Yeah, I think we have an obvious new, so to speak, or enhanced supply shock coming from the purely arithmetical effect of people calling in sick. We're seeing this everywhere. It was a main reason for this airline craziness that we've had recently. You got grocery stores, you got healthcare workers, just a lot of people sick. We're about to start the semester here in Princeton. I don't know how many people are going to get sick in a short period of time. I'm hoping I'm not one of them. But there's an arithmetical effect. If the normal absentee rate in your business, I make up these numbers, is 1%, and suddenly it's 3%, you've got 2% less productive capacity quickly. And that's going on now, but hopefully not for long. This comes back to what Jess was saying before about the fast up and the fast down. We're all praying for the fast down. But while we're experiencing the fast up, that's taking a toll on labor supply.
Shaman Ramani writes and asks, how much do you think financial conditions have to tighten to prevent, let me say here, just like here we got, to prevent, how much do you think financial conditions have to tighten to prevent aggressive Fed tightening? If the 10-year trades to 2 to 2.25% and equities in Fed funds get to 1% based on your forecast, is that adequate?
That was for Bill, I'm sure.
Well, I would say that the market already is expecting the Fed to raise rates to, say 1.75% to 2%. And so that's already embodied in bond yields today and the stock market today. So if the Fed just delivers what the market's priced in, I would anticipate that it's not going to have a huge implications for the bond or stock market. So I would say the Federal Reserve has to do more than that to actually have a significant effect on bond and stock prices. It's hard to know exactly how high do bond yields have to go to really start to tamp down housing demand. I mean, it looks to me like housing demand is way in excess of housing supply, judging from what's happening to home prices. So I would think that you'd have to see, mortgage rates up, at least 100 basis points before you start to really cool off the housing market sufficiently to meet to match demand with supply. In terms of the stock market, I mean, the stock market went up something like 25-30% last year. So, taking the stock market down 10% is nothing in terms of financial conditions. This reminds me a little bit of 1987, where we had the stock market crash in 87. Everyone was convinced that was going to lead to a recession. Didn't lead to a recession at all because the stock market was up very sharply in the first 8 months of 1987, and the crash just returned the stock market to where it started. So I think you need stock prices down a significant amount before it really starts to crimp investment and crimp spending decisions based on household wealth, because the wealth just hasn't been there that long. I mean, a lot of it's just arrived in the last 12 months.
Good, thank you. We're going to come back to a lot of the economic issues. I have a whole bunch of epidemiological and more clinical and looking into the crystal ball of the future coming in for Jessica. Jessica, on surveillance, just from where you sit and from the modeling world and the data that you look at, what would you most like to know in terms of future surveillance?
So a pandemic is clearly a population level problem. And the thing that allows these variants and the virus, in fact, to spread is individuals who are susceptible to infection. If we had a much better sense of who was vulnerable in that way versus who wasn't, so if we had comprehensive immunological surveillance, I think we'd be in a better place for projecting the immediate path of variants and the pandemic, but also we'd be potentially able to react in terms of developing novel therapies like anticlonal monotherapies, et cetera, by using the information we would gain from this. So I think one of the really exciting directions forwards would be an increasing that slightly unusual surveillance, which sits somewhere uneasily between medical measurement and public health surveillance, but I think is a really important area.
Talk to us a little bit about other infectious diseases. What does the current landscape for things other than COVID, where our focus appropriately is today, but what does the landscape look like in the face of perturbations associated with COVID-19?
And this is a great question. And it's, of course, very interesting that all of the, what we've been calling non-pharmaceutical interventions, all of the restrictions on mobility, all of the closing downs have, of course, affected all the other viruses that use the similar route of transmission to COVID. And as a result, numbers of susceptible individuals have grown up. So the degree of susceptibility of the population has increased. And we're beginning to see surges in infections like influenza and respiratory syncytial virus to larger degrees than we would have seen before. Some of the enteroviruses, some of the ones that are related to polio but that can cause paralysis in children are also surging potentially. So this is certainly something we need to keep an eye on, and is to some degree predictable, but also would benefit from that sort of immunological surveillance we've discussed. There is a really interesting question around what happens as, often influenza strains come out of Southeast Asia, out of China. Continuing restrictions there really change the global landscape in terms of influenza circulation in interesting ways. And as a final point, that I was referring to T-cell immunity, this immunity against disease rather than infection, prevention of infection, has been, just as it's growing, that tide is growing in our populations against COVID, it's diminishing against these other infections which have been prevented. And so you might see more severe outcomes on that other side as well. Something we need to know.
You have the optimistic scenario and the pessimistic scenario. You were very careful not to lean into either one. But if I forced you a little bit into that leaning in, where would you sort of lay your bets? And again, I know that's totally unfair to ask, but they're contrasting scenarios, and a lot is being made today. And I'm, for one, a little more optimistic because of the endemic aspects if we reach it. And I feel like that we are, but it's kind of just gut feeling. But where is your sort of center of gravity on it?
Well, it might be that, just as Alan said, we're all tired. And so I want this to be over as well. But I do tend towards optimism. And I tend towards optimism because everything suggests so far that prevention, immunity against disease seems to be fairly robust and seems to be quite wide-ranging. The virus might have to move quite a lot to shift away from that protection. But I think we need clarity on what our policy goals are. Are we releasing cases and focusing on that? And if so, how are we doing it? And how are we ensuring that our health systems and our healthcare workers who have been so punished over these last couple of years are being maintained? But yes, Bill, I'm a little bit optimistic.
Is the testing issue, and we don't have time to go into the depths of testing, but I think it's regarded as one of the failures or errors that has been made in terms of lack of aggressiveness in our policies, and it's the science of it, the way the FDA had handled it and our country has handled it. Testing today, people are asking me all the time, is that, well, yeah, I had COVID and I got my rapid assay and I was sick for 3 days. It was like a bad cold. And this is just taking an example because it can be much worse than that. But I didn't report it to anybody. There's no database for me to report it to. I didn't tell the state. I didn't tell my local public health department. How does that affect somebody like you who's doing the modeling when this data is out there and you see these figures that are coming in? But I would say, at least among the people I see every day and talk to, which is a lot of people, 70% is not reported because it's through the home test assays. But how does that affect your model?
Well, I think you're absolutely right, of course. I mean, we know now that cases are going to be vastly underestimated. They've always been underestimated to some degree, but there's this whole other layer now where people are not obliged to go to testing through official channels, which is in one way a very good thing, right? It's nice that people are empowered to identify situations in a relatively straightforward fashion. I mean, this would be in the world where we actually all had access to rapid tests, which is not the case, but that would be wonderful. The cost being the inability to report that information and the ways in which that will obscure the trajectory of the pandemic. There are other angles we can use to obtain this information. So, for example, immunological measurement across the population could tell us indirectly what was happening, even if we weren't directly recording the cases. But it's a great question. And I think triangulating on this as we move into the new world, where potentially some of the ways in which we're controlling this pandemic is by providing people access to such rapid tests, we're going to need to think about ways in which we manage our surveillance.
Boosters, are they going to be a part of our armamentarium and expectation of the American people?
So I think it depends on where we fall between that optimistic to pessimistic path. It's hard to say at this stage whether I mean, in the optimistic path, no, it really would be the case that more boosters so that everybody has those 3 doses. And once people have those 3 doses, in the best of all possible worlds, will be protected against future disease from any emerging variants. But we might not be in that world, and we might need to start updating the vaccines to map to new variants. It will depend on what happens in the coming months and probably in the coming winter.
I think one of the great things about our last 4 episodes and this one is this integration between the modeling, the reality, what we're seeing today, the lack of predictability as we both make forecasts, and most of the questions, and we're getting scores and scores of questions are about the future, and to have your voice and that integration with the economics, and as we look into these crystal balls, is really very, very helpful. Peter Cooper asked, how fast do you see, to the panel, how fast do you see the Fed balance sheet being run down, and how many rate hikes will that be worth? Bill or Alan?
Bill, take the first crack.
So the Fed basically is going to follow the same game plan as last time, where basically first you do the taper of the asset purchases, then you lift off the level, you raise the level of short-term rates, and then only then do you start to begin to run off the balance sheet. So they're going to follow the same game plan like last time. What's going to be different, though, is they're going to do it faster. It's all going to occur in much less time. Last time it was 3 years from the end of the taper to the beginning of the balance sheet runoff. This time it's probably going to be 9 months or so. So that's going to be different. What's still being debated is when do you start the balance sheet normalization process relative to the level of the federal funds rate. Last time they started when the federal funds rate got to 1 to 1.25%. There's some discussion by some Fed officials that they'd like to start the process sooner than that at a lower federal funds rate. In my own mind, this is a little bit contradicts the other idea that the Fed has been very clear on, is that they want the federal funds rate to be the primary tool of monetary policy. Well, to really have the federal funds rate be the primary tool of monetary policy, it has to be available to use. And that doesn't mean just use in the tightening direction. It also means use in the easing direction. And so that's an argument, I think, that reinforces the idea that you'd like to get the federal funds rate a bit off the zero lower bound before you start the balance sheet normalization. But my view is that I don't think they've decided yet. I don't think they've decided. The substance of how they do it is going to be the same, but the timing is going to be a lot earlier in time, and it might be a little sooner in terms of the level of interest rates.
Alan?
I basically agree with Bill. I would shorten my guess. I would even make the gap between the end of the taper and the beginning of the runoff shorter. Bill said 9 months. I wouldn't be surprised a bit if it was a lot less than that it came really quickly. Unlike Bill, who's already stuck his neck out, I'm thinking the Fed funds rate probably tops out at about 2.5. But that's hinges on the relative optimism that I have compared to Bill about the behavior of inflation. It's going to be sensitive to the behavior of inflation. And then finally, I don't think Bill didn't quite address, but he remembers the episode. A few years ago, the Fed encountered surprisingly a shortage of bank reserves when they had trillions of them. So I think the Fed is going to be a little, it's going to be testing the waters gingerly and not trying to get back into that position where it accidentally creates a shortage. It's hard to imagine, with $4 trillion of excess reserves that there's a shortage, but it sort of started to look that way, and they don't want to go back there again.
Yeah, I think the risks there, Alan, are a little bit lower than they were last time because, as you know, they now have this standing repo facility that basically offers Fed credit to primary dealers and banks should they need funds. Last time they didn't have that, and so when there was a shortage of reserves, it led to a very big spike in repo rates. This time, if there's upward pressure on rates, people can go immediately to the Fed facility. And so I think that reduces the risk somewhat of that kind of repetition and probably makes them a little bit more comfortable. The problem the Fed has is, as Alan knows very well, is they don't really know exactly what that point is where reserves go from being abundant to being relatively scarce, because the demand for reserves is driven by a whole bunch of factors, including how banks have to be resolved if they were to fail, liquidity requirements, all sorts of things. And so the Fed doesn't have a really good estimate of what level of reserves leads to upward pressure on short-term rates.
Bill Dana, support ask, is monetary stimulus really disappearing fast? Don't the easing effects from asset purchases persist until the balance sheet begins shrinking again? Or are the flows more important than the stock of Fed assets?
Well, I think the answer is we don't really know, because we've only run this experiment one other time. And so we're still learning to see about how does balance sheet normalization affect the level of bond yields. This is really another reason why the Fed likes to rely on the federal funds rate as their primary tool of monetary policy, because they don't really have a good sense of how the balance sheet tools work in terms of their effects on the economy. Now, you could argue today that the Fed is still adding stimulus because they're continuing to buy assets. But on the other hand, you could argue that the Fed is already tightening because people are are anticipating what the Federal Reserve is going to do 6 to 12 months from now, and that's actually pushing up bond yields. So it's a very tricky question to answer. Is monetary policy continuing to add stimulus today, or is it actually starting to move in a tighter direction as people anticipate these future moves from the Fed?
Any response or any comment on that, Alan?
No, I could just let that stand. Thanks.
Let's see. Let me group some of the questions here. Eric Kim says the FDA director recently told Congress that most people are going to get COVID. What does that mean exactly in terms of policy response and individual response? Should we be doing more of what California is doing by allowing asymptomatic COVID positive hospital employees to avoid quarantine in some circumstances? Jessica, just more generally in the question, the implication is that most people are going to get COVID, and in terms of policy, any comments at all in terms of response?
So I think we still want to avoid getting infected if we can. The question of long COVID is an obvious one. The question of the vulnerable amongst us whom we're putting at risk is also another reason. There's not, although I do think it's very likely that the vast majority of us at some point in our lives are likely to be exposed to this infection, that isn't a given. However, we absolutely have to be sensitive to the fact that the airlines, everything's grinding to a halt as people just can't go in and can't work, even if they're not feeling so bad. So how you balance these two features is, I think, a very delicate thing, and something that might be facilitated by things like rapid tests, by better masks, and by interventions that would make it less of a stark decision. But this is a very tricky area where more information would, of course, be better.
Yeah.
There was just a study on the NBA players, I don't know if you saw, which looked at the trajectory of virus in those individuals. Someone could get a sense of how Omicron translates into transmission over time. So these sorts of studies are going to help us refine that.
Evangelos Stravelis asks and has a statement as well. There are two engines driving inflation. The first engine is exactly what is running dynamically today, namely the engine of energy prices and bottlenecks in production in relation to a strong restart of consumption, demand, and investment. And it is completely independent of the behavior of monetary policy. The second driving force behind inflation is expectations of businesses, households, and market participants. Here is where the Fed is not delivering. It is still not understood that precisely because the pressure comes from the supply side. Why is the Fed not acting? Open it up.
Well, I'm not sure I buy the premise. The Fed is saying things like that this is a lot about bottlenecks, and the bottlenecks are not going to last forever, but inflation is too high. And, Jay Powell likes to use the phrase, we will use our tools to bring inflation down. And everybody knows the tools mean higher interest rates. So he's sort of brandishing the hammer, not lowering it yet, but brandishing it for exactly that reason, to show that the Fed has not forgotten about inflation. But as the premise of the question said, it doesn't look like that's coming from excessive growth of M2. M2 growth has been really, really high, though. So for those people that cling to the M's, they finally have a straw to grab.
I think at the end of the day, people are still confident the Fed is going to do what they need to do to keep inflation in check over the long run. And you can see that by looking at the spread between Treasury inflation protected securities and nominal Treasuries, looking out 5 years from there. So 5 years forward. And that has not really moved up. So people are basically saying that, yeah, I'm worried about inflation today, but the Fed Reserve will address it and we'll get inflation under control on a sort of 5-year time horizon. Senator, if I could ask Jessica a question about COVID. So China has followed a very different strategy in terms of COVID, in terms of essentially zero COVID. Given the contagiousness of Omicron, is that going to work, or are the ramparts going to be breached and they're going to have a really serious problem as COVID spreads very rapidly through China? What's your assessment of how does Omicron change the efficacy of that strategy?
I think even before Omicron, the efficacy of that strategy was challenging, right? They're just having a fortress country was always going to be tricky because people turn up and infections spread through boundaries. It's going to be very interesting to see what happens, because I can't imagine. I mean, China also deploys unimaginable force to repress infection, but Omicron is also unimaginably transmissible. So I think it's going to be a very interesting outcome. And I don't know quite how easy it will be to switch trajectory for the political leadership. So I don't know quite what happens there.
Also has some interesting economic consequences. I mean, if China continues to try to just keep it at zero by shutdowns, then the supply disruptions coming out of China will be quite severe. So I think it's a really big wild card in terms of the global outlook, how this plays out in China.
Completely agree. I suppose maybe what will happen is Omicron will go everywhere, but they won't say it has.
Yeah, Alan, any other comments on China and the impact? It ties in so much in terms of the policy, the behavior, supply chains. Any other comments?
Well, I think the tying this to the Omicron is kind of a subset of the broader question of what this pandemic is doing, but more importantly, looking forward, is going to do to global supply chains and world trade in general. There was a strong movement over decades to just-in-time inventories, for example. And I think this episode is going to push people back in the direction of just in case, to stockpile things. And related to that, this is kind of a 2x2 matrix. There is already a visible tendency, and I think it will continue for a while, to source things domestically, as opposed to source them globally. There was a big trend in that direction for multiple decades, which, by the way, was one of the quote secrets of China's success. China doesn't use all the components that it produces. It needs buyers.
I would just add to that, that just in case will actually tend to contribute to more inflation, because it's going to make the economy stronger for longer. And there's also going to be some productivity consequences of having more redundancy in supply chains.
Yeah, it's presumably a little more expensive.
A little bit more expensive. So I think that factor is another potential negative on the inflation outlook, frankly.
Alan,
Let me just add one more thing to that. A political remark. There is bipartisan agreement these days on almost nothing, but the one big exception to that is trade, where it used to be either the Republican Party or the Democratic Party was the free trade party, and the other was the protectionist party. They're now both protectionist parties.
no, that's correct. Alan, you mentioned in your opening remarks, and we talked a little bit about it, the overall withdrawal of fiscal and monetary stimulus. Should we view those as having major or minor effects on GDP?
Something in between, not trivial. If you look at the projections from now going forward, what's sometimes called the fiscal thrust, that is the delta in fiscal policy pushing the economy up or pulling it down, that's turning negative around now and is going to continue negative. It's been incredibly positive for 2 years, and it's not a trivial magnitude. What I think may stand against that, now I'm in the realm of hunch. So that's a fact, unless Washington turns around. What's in the realm of hunch is I'm still relatively optimistic about the economy because I think the consumer's pent-up demand as we shake off the pandemic is enough to offset that. Consumers have piled up $2.5 trillion or more in liquid assets. A lot of it's in bank accounts, relative to what would be normal behavior. That's a lot of money that I think is going to get spent and offset what will, in an arithmetic sense, be a fiscal contraction.
Yeah, I agree with Alan on that. I mean, household debt has come down a lot. I mean, so we have a government debt problem. We don't have a household debt problem. And household debt service costs, the amount of money they're paying out to service those debts at an all-time record low relative to income. So there's a lot of capacity for households to sustain their spending, even as fiscal policy turns restrictive.
Bill, the Fed seems so much less deterred by Omicron from moving quickly towards a tighter policy regime when we compare it to earlier waves. What is so different about this time?
Well, I think there's a couple of things. Number one, they recognize that it has both demand effects and supply effects, and it's not clear which of those effects are going to dominate. Number two, I think they think that it's not going to last that long. Number three, they notice that the amount of social distancing and effect on economic activity from each wave of the virus seems to be less than the wave before, because people are just getting used to this, and they're starting to, it's going from pandemic to endemic, and it's now becoming sort of more normal way of life. And you can sort of understand that with people who are triple vaccinated are pretty well protected against really bad outcomes under Omicron. So they're presumably going to, they're going to more go about their business than they did before. And the people who aren't fully vaccinated never were that worried about the health risk of Omicron, presumably, because if they had been worried, they would have gotten vaccinated. And so they're not going to social distance that much either. And so, I mean, I was watching the college championship game on Monday night. I didn't see anybody in the stadium or on the sidelines wearing a mask. And I just thought that was pretty remarkable.
I hate it when things begin to come to a close, but we're just about there. And I do want to make one more round of everybody, give everybody a minute, just based on what either you've heard or something that you'd like to share with our audience. But before doing that, I want to thank you again, to our listeners in particular, for those of you who have participated in sending the many, many questions in, for joining today's COVID-19 discussion, sponsored by Princeton University's Griswold Center for Economic Policy Studies and the Center for Health and Wellbeing. and a Second Opinion podcast, Rethinking American Health. As I mentioned earlier, a full recording of today's remarks will be posted on the Griswold Center's website and next week on a Second Opinion podcast. With that, each of you, let's go around, and Jessica, I'll begin with you and just spend less than a minute, sort of, if there's a question or a final comment or a look to the future, would love to hear it. Jessica, and then Bill, and then Alan.
Well, I very much hope, as I said earlier, that we are on the start of the bumpy road to the end, but I do think it's incredibly important that we maintain all the tools we have for surveillance, particularly in the light of the points raised by Senator Frist around loss of information on cases. And this virus has provided a nasty surprise on every possible occasion. So I think we have to, while being optimistic, maintain a concern about that.
All right, Bill.
My view is just simply the Fed has said they'll do what they need to do in terms of inflation. So now the question is, are they actually going to do it? Talk is cheap relative to actually action. So I think we're going to see over the next 6 months or so, how seriously they grab the reins to actually start to move monetary policy in a tighter direction.
Alan?
I just point out that one thing we haven't discussed, maybe it's just the composition of the panel, is the inequality, the implications of this pandemic. This was not an equal opportunity virus. And some of the COVID relief packages like CARES and the others addressed that, not enough, but addressed it. But that's dropping out. That was temporary stuff. And what looks to be the abject failure of the Build Back Better program in Congress has short-circuited, hopefully only short-circuited, we'll get back to it, but at least temporarily ended the government's efforts to address that sad aspect of this pandemic.
Yeah, I think, just about every discussion that I'm in the business world and the nonprofit world, the philanthropic world, is beginning with the discussion of equity and the equity issues, as well as the diversity issues, with the equity issues that have been brought to light, and both the direct disproportionate impact as well as the need for a response that recognizes that. I guess I would close by saying, and sort of dropping back a bit, and say that there are some rays of optimism that we shouldn't forget amidst the grief and the loss and the 5.5 million deaths globally, all the tragedies that, and I hope, as Jess said, that we're entering this post-pandemic phase this year, coming year. And post-pandemic really just means that COVID-19 is becoming endemic, which I believe, don't know that it is and will. And once this Omicron wave passes, and right now in this session, it seems to be peaking just about now. It has clearly in some parts of the country. And there's a good chance that the vast majority of Americans will have either been infected or vaccinated or both. And this immunity should make, and I guess we should say could make, future variants, for the reasons that Jess said, centering in large part around T cells, less deadly. And that would allow for a welcome shift in the response requirements that we've talked about today, whether it's workforce, reducing school closures, the degree to which quarantine brings disruption to our lives. If we look around the world, we didn't talk globally very much today, nor is that the intent of the panel, but this year, within 12 months, the developing world should be vaccinated, and what the threshold is can be debated. But if you look at some encouraging things, by March, as many as 1 billion doses should arrive in Africa, or will arrive in Africa. And that, in theory at least, could vaccinate 70% of the continent's population. And that's where the remarks on equity are really important. We have to make sure those vaccines are made available, and they are going to be made available, but actually applied appropriately. Good vaccine news. I have to mention it just because we haven't talked about it, but it's been unbelievable. This year, we're going to see the world's first vaccine for malaria. And we talked a little bit about other surveillance, but malaria disease, which kills over 600,000 people a year, we're going to have a vaccine. Moderna has a first stage clinical trial now on AIDS, HIV vaccine, something that we don't know if it's going to work. We've tried in the past, but with these new techniques, it may just work. The likelihood is higher. The technology is there. The technology will be used against the mRNA technology against tuberculosis as well. Some cancer treatments, a lot of promising there. We've seen these changes in the employment and workforce that are empowering employees, leading to more generous health and wellness benefits and a lot of flexibility that is tremendous for families today. We have to work through it, but that flexibility we didn't even think about 2 years ago. Diversity corporate America has slowly, but in a determined way, has become more diverse. Right now, almost 50% of all new members of S&P 500 company boards are from historically underrepresented groups, something that the pandemic didn't cause, but probably contributed to the acceleration of that. The infrastructure and the bills that have gone through, again, potentially constructive in lots of different ways. So as a result of the pandemic, more Americans and people globally are reconnecting with the outdoors, with nature. We're addressing climate change in a more aggressive way than in the past. So I mentioned all of these very peripheral things, in part because I don't want to be over optimistic, but I feel a lot more optimistic now than I have in the past for a lot of the ecosystem that is moving in a positive direction. So I toss all that out because I think there is some reason to be hopeful and to not forget that these little rays of hope amidst all the many hardships we've all experienced are true possibilities, if not probabilities. So with that, I want to thank our panel. I want to thank all of our participants today. And until our next discussion, thank you for joining us. That concludes our program.